In the common space we share, we must ensure that we are not trampling on the rights of others, like the right to enjoy a pollution-free environment. So before we smoke or light a fire to burn garbage, let's think about the people we're hurting. Hi there, I'm Edwin Atkinson, your host for this edition of Jamaica Magazine. Thanks for joining us. On the pages today, the ban on tobacco smoking in specified places and the damage you avoid in supporting it. Plus, improving safety on our roads. We also have our top news stories of the week. So for all that and so much more, stay with us.
Smoking, it's bad for your health. There's nothing cool about this habit. Tobacco smoking is a silent killer that will snare you in a horrific cycle of addiction that robs you of your money and your health. So stop if you've started, or resist before you begin the habit. Stay healthy.
Limiting exposure to tobacco smoke with its over 40 cancer-causing agents and its contribution to numerous non-communicable diseases is expected to bring significant benefits to Jamaicans. Let's find out more on this silent killer.
Gains are expected for Jamaicans in the long term as people become more aware and conform to the ban on smoking in public places. These smoking restrictions are an important step towards reducing the health risks as well as the financial strain on the individual and the public purse. It's predicted that cancers and cardiovascular diseases are expected to be reduced in the next 3 to 5 years as a result of this control measure. And so far, support has been encouraging.
I am pleased to note that the smoking ban regulations enjoys 83% support among you, the members of the Jamaican public.
And the public will be able to breathe easier in a number of areas. These include public transportation, workplaces, government buildings, health facilities, sport and recreational facilities for use by the public, educational institutions, areas specifically for use by children, and places of collective use such as bus stops. While the restriction puts a stop to smoking in these places, it is hoped that those who smoke will be encouraged to quit the habit and potential smokers won't start in the first place. However, those who choose to light up may still do so, as long as they're not infringing on the right of others to breathe smoke-free air.
One of the things that I'm so happy about is the smokers who have been interviewed, and at least 7, 8 out of 10 are saying, I am glad for this thing because it's a long time I want to stop smoke, but it's hard.
By reducing exposure to secondhand smoke, the risk of cancer and other tobacco-related illnesses will be greatly reduced. Scientists tell us that there are over 4,000 harmful chemicals in tobacco, most of which silently poison the body. Among the more lethal, arsenic, a chemical used to make rat poison, carbon monoxide released in car exhaust fumes, and nicotine used as an insecticide. The effects on the body can be immediate and can persist in the short, medium, and long term.
10% of persons who die from tobacco exposure are persons who have never smoked themselves. A national study showed that 4 out of 10 students live in homes where others smoke. Nothing can be fair about that.
It causes numerous health problems in infants and children, including severe asthma attacks, respiratory infections, ear infections, and sudden infant death syndrome, SIDS. Exposure to secondhand smoke also increases the risk of heart disease by as much as 30%. It increases the risk of having a fatal heart attack and increases a non-smoker's risk of developing lung cancer by 20 to 30%. The smoking ban also provides protection for workers on the job, which covers any space used by someone for employment purposes or in their trade or business. Fines and custodial sentences can be imposed on organizations that fail to comply with the regulations after the 6-month period from July 15, 2013, when the law came into effect. Under Section 15 of the Public Health Act, if a company breaches the regulation, a fine of up to $1 million can be imposed. The government is urging compliance and partnership as it seeks to deliver on its commitment to safeguard the nation's health and reduce premature deaths from non-communicable diseases (NCDs) by 25% by the year 2025. Statistics indicate that approximately 1 out of every 6 deaths is due to NCDs, mainly cardiovascular diseases, diabetes, hypertension, and cancer. Data also show that the cost to administer medical treatment for some NCDs, like cancer, averages as much as $3.6 million. With the ban on smoking in specified public places now in full effect, the improved air quality that will result will lead to reduced prevalence of NCDs. For clarification on any aspect of the ban on smoking in public places, you may call the ministry's hotline at 1-888-537-6885 or 967-0306. You may also send an email to huttonv@moh.gov.jm or adrianb@serha.gov.jm. For smokers who want to kick the habit, counseling is available through the National Council on Drug Abuse, the Jamaica Tobacco Coalition, the Heart Foundation of Jamaica, and the Jamaica Cancer Society. The Ministry of Health, prohibiting smoking in specified public places, preserving the good health of the nation.
There's a long-distance relay that's still on. Many have taken it this far, each leg as important as the next, each challenge faced with determination. Now it's your turn to take the baton. People living with HIV and AIDS and those who are vulnerable need your commitment. It stands in the way of a better quality of life for all of us and our self-respect as a region. It stands in the way of victory in the fight to stop the spread of HIV. Reject stigma and discrimination. Get us to zero.
Road traffic fatalities were less in 2012 than at any other time over the previous 13 years. But the government is determined to see those figures reduced to far less through increased road safety, and it's everybody's business.
I love the speed. When I man touch the road, I fly like a kite.
No! No! Oh, I'm one son. I'm dead. I'm dead.
Road traffic fatalities and injuries are a major public health challenge that requires concerted efforts for effective and sustainable prevention. When someone dies or is injured, it affects everyone. Recognizing the urgency to address our road crash fatalities, Mr. Hare says it is important that focus be placed on the 5 E's of the road safety policy: emergency response, environment, engineering, education, and enforcement. Of the 5, however, he says much can be achieved through education and enforcement.
Not to say that environment and emergency response are not important, which we believe are very important, but those other subsections require some more medium to long-term work. The education and information, very, very critical component of our road safety activities. And enforcement of the Road Traffic Act is crucial. Therefore, the Jamaica Constabulary Force, every sector of the police force, whether the police officers are traffic officers or not, should see themselves as playing an integral part in bringing road fatalities down.
He says for this year they will be carrying out a number of programs to address the issue of improper road usage.
We will be doing our outreach programs. We are going to places where pedestrians congregate, and we are going to speak with them about their operation. We're going to carry the message face to face, right? Not only Yes, we're going to use up the print, the electronic media. We're going to do that. But we're also going out there to interact with these road users. We have to get the message out there, and we are going to do it, right, to ensure that our people practice the proper rules that govern the roadway.
The World Report on Road Fatalities and Injuries states that worldwide, an estimated 1.2 million people are killed in road crashes each year, and as many as 50 million are injured. Although this is so, Mr. Hare says Jamaica is not doing badly when compared to our Latin American partners.
We are in the medium level of the Latin American and Caribbean accident barometer. But which means that once you are between, your fatality rate is between 10 and 20 fatalities per 100,000 population, you are considered to be in that medium level, which you are doing work, you are doing a lot of work in terms of road safety, trying to bring the road fatalities down, but however, you still have more work to do. Because you really want to be in that low risk group whereby your fatality rate is below 10. But presently we are at 12.75 per 100,000 population, which is fair.
Low and middle income countries account for 85% of the deaths worldwide and 90% of the annual disability adjusted life years lost because of road traffic injury. The director notes that although Jamaica is doing fairly well, this is not good enough and much more needs to be done.
Those motorists who flout the Road Traffic Act, who drives at excessive speed along the roadway, who disrespect road signs and markings, who show no regard whatsoever for other road users on the roads, we need to allow the long arm of the law to put them away, take them off the roads, don't allow them to be on the road at all. We are going to ensure that every pedestrian crossing is painted. We're going to ensure that every school area is properly demarcated with the necessary signs. We will continue to use the Drive for Life program to spread the defensive driving message across Jamaica. There will be no let-up.
Strong families are important to the development of our society, and the National Family Planning Board wants you to be healthy and achieve your goals. Make the right reproductive health choices. Help eradicate poverty, improve maternal health, and reduce child death by avoiding unintended pregnancies. Waiting until you're financially, physically, and emotionally mature to become a mother. And protecting against diseases such as HIV and AIDS. Exercise your right to plan stable families for the future, being mindful that children need nurturing environments for proper growth and development. Consider your health, the timing, spacing, and number of children as you plan. Be empowered. Contact the National Family Planning Board at 5 Sylvan Avenue, Kingston 5, P.O. Box 287. Telephone 968-1627 or visit them online at www.jnfpb.com.
Increased production and productivity in goods and services for local consumption and exports is the means by which Jamaica is seeking to correct some of the issues affecting the economy. No doubt, science and technology can make that task easier. Take a look.
All this can be a thing of the past with the implementation of protected agriculture. There is nothing more pleasing to a farmer than to see the beauty of his crops. A few years ago, farmers in Jamaica were affected to a great extent by the tomato yellow leaf curl virus, commonly known as the Jerry curl virus. This resulted in severe crop loss. But with the aid of protected agriculture, farmers now have the option of growing plants in a more controlled environment. This structure, known as a greenhouse, offers a way to protect plants from the external environment risks, such as pest and disease infestation or severe weather conditions.
Having them in protected agriculture setting, we can somewhat shift our climate, shift the internal environment to suit the plant.
The Ministry of Agriculture, through its Bodles Research Station, has been helping farmers with the use of this technology to have better yields on their crops. And a useful technology it is. The material used is a protective mesh that can keep out the smallest of insects, such as aphids, also called plant lice. These small sap-sucking insects are destructive pests to cultivated plants.
In keeping out aphids, we actually keep out viruses. And keeping out the other insects, we will do the same thing as keeping out viruses, as well as keeping out lepidopterans, which will come in and actually eat the leaves of the plant.
The double door feature is another way of controlling insects from getting inside. This is recommended for every greenhouse, and at no time should both doors be open. After entering through the first door, there should also be a foot bath with about 20% bleach solution or some other disinfectant that will help to get rid of unwanted pathogens off the shoes. So with the first door closed and foot washed, the second door can then be opened to the crop. Insects are not the only danger to plants. Climate conditions also pose a risk. So plants in most greenhouses are grown in a controlled temperature environment. This is adjusted with the aid of shade screens. These retractable screens block out excess sunlight or let in more as the need arises. The shade screens can also be programmed in automated mode, and as the sensor detects the temperature inside the house, the screen will automatically open. Plants grown through protected agriculture are also kept at a moderate temperature by airflow fans, which help with the circulation of air around the greenhouse. The irrigation process is another important area of protected agriculture.
The irrigation system that we use is actually a drip irrigation system. We do not do overhead irrigation inside the greenhouse because we do not want the leaves to get wet. When leaves become wet, you can actually have fungus growing on the leaves of the plant and then destroying the entire crop.
All this is monitored through a timer system that allows for manipulation of the entire nutrient feeding process.
This system now allows for mixing of the fertilizer, which is in these two tanks. So different elements are combined to feed the plants. The irrigation water comes here, and the injectors pick up the fertilizer, mix it along the line, and then combines it. At the end of the mixing process, it is sent to the plants.
Now, in the protected agriculture environment, if farmers manage their crops well, the yield and quality will be much better, and the result? Less spoilage and more revenue.
The main reason is that the farmer controls the environment and controls the fertilizer that is going towards the plant. And there is no pressure from weeds utilizing the nutrients from the soil as opposed to the plants.
So if you are considering going into agriculture or you are already in the field, here are a few benefits of protected agriculture to consider. It gives good production when compared to normal farming. Humidity can be controlled, thus eliminating the breeding of pests. Crops can be grown throughout the year, and the greenhouse gives protection to plants against weather conditions that can damage or influence growth. For further information, you may contact the Bodles Research Station of the Ministry of Agriculture at 983-2281 or 983-2267.
Finger-licking jerk chicken, Helcher fish and bami, will run down yam and banana, roast breadfruit, sweet potato pudding. Jamaica food, sweet. This November is Eat Jamaican Month, so let's make a pledge to use more local produce and less foreign goods. Let's grow what we eat and eat what we grow.
Sweet, sweet Jamaica with
It's the last day of observance for Police Officers Week, November 24 to 30. But not too late to hear what you have to say about the important role police officers play in society.
They play a very vital role in maintaining the law in our country. For example, accident day there on the scene, and you feel a sense of safety and security.
Police officers are very important to the society. I mean, they help to maintain law and order in the country, and I think without them it would be chaos.
Police are considered an essential part of a democratic society. They help to maintain peace and to control violence, and they help to maintain the public's interests.
I think that police officers are very important in stemming the crimes and violence that are happening in our community and in our country.
Police are very important in our society as they control the day-to-day activities that go on and help to stem and keep violence on a minimal in the society. We live in and realize Jamaica is a third world country, and the police on a whole help to bring out a sense of calm and peace for the people on the street.
Upgrade of Oteria's resort town to start immediately, and up to 400 jobs to come for the tourism sector. And Prime Minister Portia Simsimila calls for more attention to the challenges of middle-income developing countries and small island states. Here's a recap of those and other important news stories from this week.
Hi there, I'm Simone Wolf with your JIS News of the Week. Prime Minister Portia Simsimila attended the European Union Development Days Forum in Brussels this week and called for more attention to be paid to the unique challenges being faced by middle-income developing countries and small island developing states such as Jamaica. During a panel discussion on women's empowerment post-2015, Mrs. Simsimila also urged women not to place barriers on themselves in order to move forward and effect change in the world. Before heading to Brussels, Prime Minister Simsimila responded to reports that Jamaicans were being denied access to some Caribbean countries. She reiterated Jamaica's commitment to honoring CARICOM agreements.
I want to assure CARICOM citizens we will not be like others. We will treat all decent citizens coming in from CARICOM with respect and with love. As one regional family shaping the future together.
Government has commenced a review of the Anti-Doping in Sport Act to strengthen the legislation and ensure that it's in keeping with the World Anti-Doping Agency WADA code. Minister with responsibility for sport, Natalie Nita Headley, also announced that the board of the Jamaica Anti-Doping Commission, JADCO, had resigned effective December 31. JADCO's new executive director, Carrie Brown, is also reviewing the agency's needs.
We have accepted an invitation from WADA for the new executive director to visit its offices in Canada during the week of December 16th. He will also visit the WADA accredited laboratory in Montreal and the Canadian Centre for Ethics in Sport with a view to establishing a cooperative partnership between JADCO and this national anti-doping organization.
Cabinet has given approval for the Non-Communicable Disease NCD Strategic Plan 2013-2018. The plan will serve as a roadmap towards the goal of reducing NCDs, including but not limited to diabetes, cancer and kidney failure. Health Minister Dr. Fenton Ferguson made the announcement while reopening the Charles Chinloy Health Center in Tivoli Gardens Thursday. The Type 2 facility was refurbished at a cost of $31 million and will provide maternal and child health care as well as curative services. Dr. Ferguson said the reopening was in keeping with efforts to improve access to primary health care services island-wide.
So as we go forward, ladies and gentlemen, as we build the primary care network, it is my hope that your center over time will become a center of excellence too.
While addressing a Rotary Club of St. Andrew meeting this week, Health Minister Dr. Fenton Ferguson voiced support for the medicinal use of marijuana. Dr. Ferguson argued that while smoking, inclusive of marijuana, has serious implications for one's health, research findings are also clearly pointing to marijuana's success in helping to treat some medical conditions. In the meantime, the Health Minister maintains his stance on the critical importance of the recently imposed ban on smoking in specified public places. Up to 400 more jobs will be provided for Jamaicans in the long term after the National Insurance Fund, NIF, entered into a management agreement with Melia Hotels International, MHI. For the next 15 years, MHI, Europe's third largest hotel chain, will operate the Braco Hotel in Trelawney that's owned by the NIF. This follows negotiations which involved the Ministers of Tourism and Labour, under which the NIF falls.
And let it be understood that our goal is not merely to have an attractive building or simply to fill its room with visitors, but also to make a strategic investment which promises to produce a multiplier effect that will ripple through our local communities.
Meanwhile, it was also announced this week that the Tourism Enhancement Fund, TEF, had provided $400 million to immediately commence Phase 1 of the Ocherius upgrading project. It involves the upgrading and refurbishing of the Ocherius cruise ship terminal and improvement to the town's main street. Jamaica and Singapore have signed an Open Skies Agreement, OSA, which will allow some airlines to fly freely between the two countries. The deal was inked on the sidelines of the 28th International Maritime Organization Assembly in London. Under the OSA, selected airlines can fly between Jamaica and Singapore, even via third countries, without limitations in the frequency of flights, capacity, and the type of aircraft. Ground has been broken for the Rio Cobre pipeline replacement project valued at $24.46 million. The project will see the replacement of segment 2 of the Rio Cobre pipeline between Content District and Ferry in St. Catherine. The project is being carried out by the National Water Commission through its K-Factor program.
An improved high-quality and continuous water supply service for customers in the Kingston metropolitan area, improve supply efficiency and reliability to residential and commercial customers.
And those were some of the stories making news this week. I'm Simone Wolf.
That brings us to the close of today's edition of Jamaica Magazine. It was good sharing this half hour with you. Don't forget, we value your feedback, so drop us a line, send an email to jamaicamagazine@jis.gov.jm. You may also follow us on Twitter at JIS News. On behalf of the entire team here at the JIS, I'm Adrian Atkinson, inviting you to join us again tomorrow. Until then, do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.